Hello, my name is Ashley. I'm going to be taking care of you. Can you tell me your name and date of birth?
Corey Tharp, 51388.
All right, Mr. Tharp. What is bringing you in today?
Had some allergy issues, some drainage in my throat, my nose. My eyes have been kind of itchy lately.
Okay. And when did these symptoms start?
Probably the last few days, probably progressed from just a little bit of drainage to I've had a little bit of scratchy throat and eyes.
Okay. And have you had any history of this in the past?
I have allergy issues. I used to take allergy shots as a little boy, and now I take Zyrtec D once a day. I've done that since I was 13 years old.
Okay. All right. Can you tell me about the drainage? Has it had a color?
It's been like normal drainage, mainly clear. Maybe if I hawk anything up or cough anything up, it might have like a small yellowish tint to it.
Okay. Have you experienced any fevers?
No.
Okay. Um, so what I'm going to do today, I'm going to do an assessment of your head, your eyes, your ears, your nose, and your throat. And let's just take a look at what's going on. As I'm going through the procedure, I'll explain it to you along the way. Okay?
Okay.
So I'm going to start off with your head. I want you to tell me if you've had any pain in your head, any headaches. Have you had any headaches?
No.
Okay. I'm going to be feeling around. I want to feel the skin and your hair, and also I'm feeling for any opened areas or lesions. Okay, that all looks great. It's very symmetrical. Now I'm going to move on to your sinuses. I'm going to mash on your frontal sinus pain.
Mm-mm.
And on your ethmoid, any pain?
No.
Your maxillary, any pain?
No.
Okay. All right, if you want to open your eyes, I'm going to go on and look at eyelids, so just look at me. All right, your sclera is very white. Your conjunctiva is a little bit red, maybe slightly pink to red, but have you had any itchiness or dry eyes?
Just a little dryness, yeah.
Okay. All right, and have you had any drainage?
Out of my eyes?
Mm-hmm.
No.
Okay, perfect. So the next thing I'm going to do is I'm actually going to test your vision. This needs to be 14 inches away from your face, so if you can just tell me the lowest line that you can read, if you'll read it out loud for me.
374258.
Okay, and if you will cover your left eye and do that same process again.
374258.
Okay, and then your right eye.
374258.
All right, perfect. So you have 20/30 vision in your eyes. Do you wear corrective lenses?
I don't know. I used to. I had LASIK surgery. So.
Okay. And how did that go for you?
Excellent.
Yeah, good.
Yeah.
Okay. The next thing I'm going to do is I'm going to use this little device called the ophthalmoscope, and I'm going to look inside your eyes for the structures, okay? So just look straight ahead. Looks great. I see your optic disc. The margins look good. Vascular looks good. Okay, and then on the other side. Looks great. Okay. All right, and now I'm going to move on to your hearing, your ears. Have you had any pain?
No.
Any drainage?
No.
Okay. I'm going to just kind of look, and then I'm also going to kind of press here and pull back. Is that painful at all?
No.
Okay, perfect. While I'm over on this side, I'm going to whisper something. If you could tell me what I'm whispering.
Cat.
Good job. Okay. Might be a little uncomfortable. If it's painful at any point, just let me know. Alright. Your tympanic membrane Nice and gray. I visualize the landmarks clearly. There is a little bit of redness around your inside of your ear. Onto the side. Pain. Pain.
No.
Okay, awesome. I'm going to whisper and you tell me what you hear.
Dog.
Okay. Alright. Same thing. It looks great in there. Clearly see your tympanic membrane. Didn't see any fluid. So that's good.
Okay.
While I'm over here, I want you to tell me when you see my fingers.
No. No. No.
On this side.
No. No. No.
Perfect. And I'm going to go ahead and do the conduction test. So I'm going to test 2 different times. The first one, I'm going to take this hammer and I'm going to place it right here on your forehead. And I want you to tell me if you hear it equally or feel it equally in both ears.
Okay.
Okay? Called the Weber test.
I hear it equally on both sides.
Perfect. The next test I'm going to do is using the same instrument, but I'm going to strike it and put it on the back here of your bony prominence from your ear, mastoid process, and I want you to tell me when you stop hearing it, and then I'm going to move it to the external canal of the ear, and I want you to tell me at that point when you stop hearing it.
Okay.
Okay?
Okay. Okay.
Same process.
Okay. Okay.
Great. So that was perfect. The next thing I'm going to do, Mr. Tharp, is I'm going to look inside your mouth, and then the last thing I do, I'll assess your nose, and then we'll move on to your lymph nodes. Okay, you can say off for me. And one more time. Okay, good. Great. Looks great. No trouble with your teeth?
Mm-mm.
Trouble chewing? Okay, perfect. The back of your throat did look a little red. There's some cobblestoning effect there, which would make me think that there's been some postnasal drip. Okay. I'm going to look up in your nose. You'll just slightly lean your head back. Okay. Right. Your terminus are red, a little bulgy, and I do see some drainage going on this side. Okay. Now I'm going to feel your lymph nodes. Check start off with your preocular, your postocular, tonsillar, and then tubular, submental, anterior cervical, posterior cervical. You'll turn your head to the left. Okay, and then to the right. Great. Let's look ahead to your supraclavicular. Okay. And your infraclavicular. Perfect. Awesome. And then your occipital. Great job. And then check your thyroid. Okay. Will you just swallow for me? Okay. Again. Perfect. Any difficulty when you were swallowing?
Mm-mm.
Let me see that again. Great job. Well, that concludes our exam.
Okay.
At this point, I would go over possible diagnosis, what we would need to do to follow up as far as diagnostic testing. I'm going to show you that there's nobody else in the room. And I would thank my patient. Thank you, Mr. Tharp,
Mm-hmm.
and have a great day.